Time for the next patient. Hello, Mr. Leonidas Cheeseburgerita.
Yes, hello.
Alright. Can I get your date of birth? March 31st, 1942. Alright, good. So I see that you have some problems with peripheral vascular disease, and that's caused some wounds on your feet. Yes, that is true. It is very painful, and it is very hard for me to walk 75 feet without getting shortness of breath. And I would really like to get back to work as soon as possible. It is very hard to sit at home and do nothing all day. I find it very depressing. Alright, Mr. Cheeseburgerita, I've noticed one thing here. Are these the shoes that you normally wear? Oh, where did you happen to buy these? Oh, I bought them at Walmart. They are very nice. Well, the problem is, with your feet problems and whatnot, you really need to have a professionally made shoe, an orthotic device in there to protect your feet from the wounds like you have. I'm going to go ahead and help you take these off. I would instruct you to try to take heed on your feet care and go to a professional store, an orthotic maker, and get some special inserts for your feet. Alright, I'm going to go ahead and get this off. Alright. Good job. Alright, Mr. Leonidas, one of the first things we're going to do here is going to do some ankle pumps. Now, the problem with PVD is that you have all this blood that's pulling up in your veins. Now, that's usually due to atherosclerosis, all the plaque generated in your veins, and that's kind of made a stoppage, and so it's kind of left down in your legs. So we're going to work to try to pump that blood back to your heart. Now, one of the easiest ways to do this is to ankle pump. You're going to move your feet up and down. I see that you have a orifice in your right foot here. So we're just going to move these feet up and down, up and down, up and down. And good job. You are going to be better in no time. Why, thank you, sir. This is very easy. It does not hurt a bit. And I do think I feel the blood move through my veins up to my heart. It is very satisfying. Good. I'm glad to hear that you're taking the treatment well and you have a good attitude, because people like that tend to be treated and heal a lot better and faster. Alright, good job. Alright. Now you are Mrs. Cheeseburgerita, right? Hi, my name is Brandon Lawrence. I'm the PTA here working with your husband. A really important part of his therapy is compression. So we're going to be wrapping his legs, and I'm going to be showing you how to do this. So the more you do this at home, the better it's going to help prevent DVTs, which are the most fatal complication with PVD. And it's also going to help, keep the blood flowing through his veins. Alright? Okay. Alright, I'm going to show you how to do this now. First, you're going to take your gauze, your wrap, ace wrap. You're going to start down here with the feet, and you're going to cross at the ankle. Now, Mr. Leonidas, you're not going to cause any problems for your wife at home, are you? No, I am not. I am just a little fussy today. And you're going to continue to wrap diagonally. You always want to keep it diagonal. You never want it straight across, or that could lead to complications. And you're going to go and continue this up his leg, and it should end up looking like this, nice and tight. Then you'll just tuck it in, and it should be nice and tight to the skin, but not too bad. And that's going to help Leonidas quite a bit at home. You think you can do that? Alright, good job. Alright, the next exercise we're going to do for you we're going to do hip flexion. Now we're going to bring this knee up. This knee up. Oh, it is very painful. Oh, oh. Is it really painful or is it just uncomfortable? Oh, maybe a little uncomfortable. We're going to continue to do this 10 times for each leg. And I'm going to do all the work right now. We're just going to let me move those muscles around. Alright. Just let me do the work right now. Okay. Mr. Cheeseburgerita, I see that the OT has you right now, but whenever you come to therapy next, there's a few things I want you to know. We're going to be testing your range of motion. I'm going to be monitoring your ABI, your ankle brachial index. It's one of the most important tests. Oh, well, basically that is testing the blood pressure in your feet compared to your upper extremity. With the impairment of vascularity, sometimes the blood pressure changes in your lower extremity or your peripheral limbs. So we'll be testing out that today. We'll be keeping your vitals done, and I'll let you get back to your OT. Mr. and Mrs. Cheeseburgerita, I called you into my office for a little bit because I have something I want to discuss with you guys. Mr. Cheeseburgerita, you have been sexually harassing my coworkers, and we just came in here to kind of nip this in the bud. Oh, all I said was, I don't care what she said, or what you said. I really would like to continue therapy with both of you guys. And my other concern was, your wife, Miss Cheeseburgerita, has been sexually harassing me as well. So, don't deny it. I'm not calling you here to deny this. We all know what's going on. You both are strange, but I want to continue therapy. So, we're going to stop this right now. Can you tell me you're going to stop this? Okay. Alright. We'll continue as we were.
So how was your day?
That's alright. We had one crazy patient. Get this. His name is Leonidas Cheeseburgerita.
It has to be an alias for something.
Yeah. Well, no, it gets crazier. Halfway through the treatment session, I'm doing some therapeutic exercise. This guy totally craps his pants right in the middle of therapy. And you know the funny part is, he's just sitting there smiling about it. He knows what he did. I mean, you can hear it come out. So, there was no nurse on duty or anything. They all take off running because they could smell it. So, it's up to me to clean this guy's butt. So, take him to the bathroom. I transfer him to the toilet, take off his diaper. The worst part about it, I could tell exactly what he ate. This guy has been eating nothing but squash. Orange squash. I could see it and I could smell it. It smelled like the most rotten, dead rodent that I've ever smelled.
We're eating.
I'm just saying. Yeah, Leonidas Cheeseburgerita is right up at the hospital right now. I mean, I can get you his address if you want it.
No,
You
thank
can go
you.
look, find him, and just laugh at him. How about you? How was your day?